First, it's my honor to introduce Doak Bloss. He's going to be the first of our speakers talking about the status of healthcare in Ingham County. He has been a long-time super activist with the Ingham County Health Department to get the Ingham Health Plan established. Do we have anybody here who's using the Ingham Health Plan right now? Okay, we at least got one. Okay, this covers what now? 16,000 people, Doak?
Not quite that many more.
Okay, but years ago when we got started in 2001, there were 31,000 people who needed health care. We got the Ingham Health Plan set up to partially help them with their health needs, 16,000. I'm not going to talk anymore. Let's bring Doak up here. You may know him as a major actor in stage productions also. Let's give Doak a round of applause.
Thank you, Bob. I don't know what I think about this vote thing. I feel sort of like American Idol now. I better do well. I want to thank you. I want to thank you, Bob, so much for spearheading this effort. The only way we are going to have the real change we need is with people like you, and people like you keep making noise all the way to Washington. What I want to do is talk to you just briefly about efforts at the local level and the national level to reform our broken healthcare system. I'm going to speak to you very briefly about what we've done at the local level in Ingham County to assure access to health care for the uninsured, why those efforts, as successful as they have been, are not enough, especially right now, to keep our community and our workforce and our economy healthy, and what we've learned, just a little bit about what we've learned at the local level, but what needs to be done to assure not just access to health care, but access to health in our community. What we've done, in 1998, a little over 10 years ago, the Ingham County Commissioners made a commitment to covering the county's uninsured. It was not a new commitment. They have basically supported health care for low-income people for decades through the health centers that we operate throughout the county. But it was a new approach. The commissioners at that time, in partnership with both the healthcare systems, Sparrow and Ingham Regional, established this thing called the Ingham Health Plan. Essentially what it is, it's too complicated to describe here, but it's for the first time an attempt to organize the care that the uninsured people receive. It gave them a medical home, it gave them a card, and it created a structure for managing their care efficiently and as effectively as possible. So within a few years, over 50 local practices were involved in providing care to the uninsured through this manageable and cost-effective process. And it was not just the 11 clinics that we operate at the county, but also places like Cristo Rey and Carefree Medical, operated by our local champion, Dr. Barry Saltman, and a number of other providers who would not have provided anything if they didn't have this mechanism to make it easier for them to do so. And within a few years, the health plan reached its peak of enrollment at 16,500 people. That's 16,500 uninsured people who had managed covered care for the first time. And over the life of the plan, it's covered over 40,000 different people. Because a lot of people come in and out, they have a temporary crisis and need this help. It's definitely something we need to have. The plan became a model for counties all over Michigan. There's now a whole division of the health department that manages the infrastructure for plans in over 50 counties around the state. But the bottom line message is that we figured out how to do this locally. You want to applaud? Okay.
Yeah.
Let me get those votes. We figured out a way to do this and a way to provide health care coverage to people if you bring the necessary stakeholders to the table and hammer out agreements that assure smooth access to care and equitable sharing of costs and risks. That's all it takes. Now, that's our success story. This is the unfortunate sequel. In the last year, the number of people who are without insurance in the capital area has risen dramatically, as you can imagine. We don't even know what the number is right now. But we know that more people with more severe health needs are turning to the county health plans around the state and to free clinics for help. But because we've managed our resources so well, the health plan has enough money to basically continue to cover people at the current level, which is about 14,000, for about 3 to 4 years. After that, it will go broke, and it will disappear. This is why a broader, more comprehensive fix is necessary now more than ever. This is why a true and robust reconstruction of the healthcare system in the U.S. must occur now while we have an administration and a Congress that's willing to confront the challenge. What we've learned, very quickly. I'll say more about this in the session later on, but one thing we know, people say who are against the change is that, uninsured people have emergency rooms. They can go to an emergency room for care. I mean, emergency rooms are not the answer, and anybody who thinks that has not been to an emergency room lately. They are expensive, they're incredibly expensive, they are non-preventative, and they provide limited or no follow-up to people that they serve. And who pays for that inexpensive, non-preventative care? You and I do, every one of us. Charity care and volunteer services are not the answer. I am eternally grateful that we have selfless people like Barry Saltman in our community who wheedle and cajole contributions out of businesses and the healthcare system to help care for the uninsured. But good deeds alone are not going to be the fix that we need. The fix we need, it needs to be comprehensive and systemic, and no matter what we want to believe, there is no such thing as free healthcare. Somebody pays for it. Somebody should pay for it. And the cost needs to be equitably distributed among all of us. Healthcare systems and hospital systems and provider networks are critical partners in figuring out how to make the systemic effects real and functional. But they are not the only partners. Businesses, both large and small, must be part of the solution because we cannot sustain economic development without a healthy workforce, and we cannot maintain a healthy working community if only people with quote-unquote good jobs have insurance. In this country, the United States, healthcare should be a right and not a privilege. Notice that I said it should be a right. It is not a right today. It is not a right. It is a right in most of the industrialized countries of the world. But it is not a right here. It is a privilege here. And this is why, despite the tremendous amount of money that we spend on insurance and hospitals and medical tests and procedures, we rank near the bottom on the national stage in the list of, in terms of healthcare outcomes. We are down there below most of the industrialized world. There has to be a better way to spend our money to mobilize our healthcare resources. This is our best time, our best opportunity to find a way, and thank you all for being willing to be part of the work.
Thank you, Doak Bloss.